Welcome to Using CASPER Reports for Data-Driven QAPI, Part 4, Using CASPER Data to Improve Care, your QAPI program. This session will work on explaining how to use that tracked and trended data from your CASPER reports discussed in Part 3 to identify one quality measure for a Quality Assurance and Performance Improvement Project program and for the Performance Improvement Project, or PIP. We're also going to look at outlining the approach to charter and mentor a team through a performance improvement project. As a reminder, the intent of the QAPI program is that the facility will be conducting these activities, including identifying and correcting quality deficiencies, as well as identifying and working on opportunities for improvement, with the intent of improving the lives of nursing home residents through continuous attention to quality of care, quality of life, and resident safety. It's very important that you integrate your quality measure review with your quality assurance performance improvement QAPI program. The QAPI plan is required to describe the processes for identifying and correcting quality deficiencies, and those key components include tracking and measuring performance, which we discussed in Part 3, establishing goals and thresholds for performance measurement, identifying and prioritizing quality deficiencies, systematically analyzing underlying causes of systemic quality deficiencies, developing and implementing corrective action or performance improvement activities, and monitoring or evaluating the effectiveness of corrective action, performance improvement activities, and revising as needed. That is the clear intent of what we're hoping you will gain from this series. Looking at the quality measure report is something that should be done monthly. And as we discussed in previous sessions, the data is updated weekly based on data that has been entered into the system in between the data being recalculated. And you probably should be also looking at not just your facility level quality measure reports, but the Nursing Home Compare Preview report that's provided by CMS quarterly in your CASPER inbox. We encourage you to track and trend percentages because the changes may point to a system or process error in care, an issue with the MDS assessment and coding process, or a change in your resident demographics, all requiring you to make adjustments. You want to narrow your focus when you look at your quality measure report so that you have a better opportunity of identifying areas for improvement. You can look at the quality measures at or above the 75th percentile as indicated on the report. You could look at the clinical significance of the quality measure. You could look at the magnitude of difference between your facility percentage, the state average, and or the national average, your actual numerators and denominators. And in some cases, if your numerators are very small, even if it is flagging, it may not be something that is going to be amenable to a systems review and may need to be more of an individualized approach. You also can look at the relevance to nursing home goals, the contribution that quality measure makes to your 5-star rating, and consider the financial impact, including how it will impact your value-based purchasing reimbursement from CMS. So making a decision about where to focus, you want to begin by identifying a target quality measure. In this screenshot, falls with major injury and low-risk residents with bowel and bladder incontinence issues have been identified because they flag above the 75th percentile. If you select these measures, or one of these measures based on the criteria discussed in the previous slide, then you want to identify members for the team. Members for the team do not have to have clinical experience in order to be part of a quality assurance performance improvement team. They simply need to know and understand quality improvement methodology, which you can teach them. Once you've identified that team, you want to conduct a process of care investigation. That's important because you want to know what should be done in providing the care for that particular outcome. Does it include specific assessments? What is the care planning that should be involved? And what interventions are considered best practice or standard of care in that particular area? You can make an all-inclusive list of those clinical actions that pertain to your target outcome and then prioritize those so that you can then create a care review tool that you use in investigating what's currently happening in your nursing facility. You want to use all available resources to narrow your investigation, and a very key one is to use your resident level quality measure report, which will tell you which residents triggered the measure that you're focusing on. You can then do a record review. You can look at the documentation, the MDS assessments that have been submitted for that resident. You can talk to the staff and to the resident to investigate what care processes have been done and compare that to what should be done. It's very important that as you're doing this deep dive into what is going on in the facility that you suspend judgment. You want to determine what was actually done, and you don't want people to hide from you what they did. That means that we have to have an environment where people feel comfortable talking about errors that they may have made or omissions of care that they may have made without fear of repercussions. I'm not suggesting that you don't hold them accountable, but they need to know that they won't be punished if they are honest with you in an effort to improve what is being done in the nursing facility. You also want to, as part of that, begin to look at trends that might be going on. Is there an issue with documentation or coding that should be addressed? Perhaps you've had a recent change in documentation because of a change to a different electronic medical record, and maybe the training didn't allow the staff to learn the system well enough to document well enough for the MDS coordinator to gather the information they need. It could also be that there are processes related to care that are no longer working well for your facility. Again, I want to emphasize how important it is to suspend judgment and repeat to yourself that what they did at the time made sense to them, because you want to understand how to improve the system. The foundation for your improvement project will then be based on what you found in that care process investigation. You want to look at specific and limited numbers of care behaviors that you can change or reinforce that will improve your outcomes to achieve the level of resident care that you are aiming for. You'll then be able to develop a statement that says, here's the problem we are addressing, or here's the strength that we've identified, and use that to develop your performance improvement project team charter. The performance improvement project team charter is something that tells the team members that you've got gathered what it is that you expect them to accomplish in this project as they are improving care. So you will identify, here's the problem that we've identified. And here is our goal for improvement. So for example, we have a high number of residents falling and sustaining major injury. We want to improve that where we have 1% or 2% of residents experiencing major injury as opposed to 10%. Now your staff knows what it is that you've asked them to do, and they can move forward with identifying interventions. There are tools available from the CMS QAPI website to help you facilitate that performance improvement team. There's a checklist for the project leaders, managers, or coordinators to use. They have a charter template, and they also have a measure or indicator development worksheet that are very useful. I want to take a little bit of time to talk about how we actually achieve and sustain change. A key to that is engaging your leaders and your staff in a way that brings home to them the importance of what's happening. And we're going to talk about the model of using 4 E's for technical and adaptive work that was created through Johns Hopkins. The 4 E's are very useful because they help to focus in on not only what it is we want to change, but why we want to change it. The technical work changes the procedural aspects of care. So it's looking at prompted voiding or catheter care or pressure reduction. The adaptive work looks at attitudes, values, beliefs, and behaviors of the people who are providing the care. Adaptive work can be discouraging and difficult to target, and you may be tempted to just focus on the technical work and ignore that adaptive work. But many change efforts fail because the adaptive work piece is neglected. An evidence-based protocol, like technical work, will only impact outcomes if staff understand, value, and prioritize use of the protocol, which is the adaptive piece. This model features those 4 key elements through engage, educate, execute, and evaluate. Within these 4 E's, you can engage your staff to understand the effects of preventable harm. For example, you can share stories about how residents are affected by this problem and estimate the number of residents who could be harmed as a result of the problem. How would that make this a nursing home a better place? That engagement will get them to see the importance of actually being successful in this change. The education piece is the technical work where you're actually talking about and looking at those clinical practices that need to happen, those behaviors to prevent the problem that you have identified. Executing is another adaptive piece of the program here, where you're looking at the principles of safe system design. You're simplifying the system, you're creating redundancy, you're learning from your mistakes, you're investigating how your current resources and culture can actually support what you're trying to accomplish or hinder it, and then address those as you need to. And then the final piece of evaluate is, again, technical work where you're going to be collecting data, identify those measures that will show you that you've improved the safety and care for your residents. Collect the data and submit it to your QAPI committee so that they can see the effectiveness of the performance improvement project team. Another piece of your quality improvement, performance improvement program and achieving and sustaining quality improvement is to engage your residents and your families in quality improvement activities. They have concerns that you can address. You can ask them what they think could help to improve things by conducting interviews. I encourage you to include them as members of your QAPI steering committee or to even put them on performance improvement project teams. For example, a nursing home was working on improving their admissions process for the facility, and it was suggested that they include either a family member or a resident on that team to help make sure that it's not only improved for the staff, but for the residents as well. We'd like to summarize some key points. That you cannot improve what you don't measure, so make sure that you actually identify some process measures that will help you to know whether or not what you're doing is making a difference before you actually can see it in your CASPER quality measure report. That quality of care is not an accident, that you have to understand the current practices and target improvements for your quality measures using a performance improvement project team, and that sustainability requires engagement of all your staff, not only through cognitive understanding, but they also need to be emotionally engaged so that they understand and are committed to the importance of making this change. And remember, we don't use our residents and family members well as resources for our quality improvement, and that's a resource that definitely needs to be tapped. Thank you for participating in this session, and remember that your state lead is available for technical assistance if you have any questions or concerns. Thank you for your time.